Our next speaker has made a little bit of a journey to be here today. She actually comes via the University of California at Irvine and in association with Chiang Mai University. She's going to talk to us about a variety of things all around the subject of hearing. Dr. Shade.
Hello. Thank you for having me. I'm so excited to be here to talk to you about hearing and hearing problems. Yeah, never heard that one before. I'm actually an ear doctor. I work in Los Angeles. I see patients that have hearing problems, that have balance problems, and I think that some people may not necessarily initially think that this is important to them, that this is worth thinking about, that this is something really critical that you need to consider. And before we continue, I just want to let you know this QR code links to this entire presentation. You can download everything here, all of the references and links to connect you to resources to learn more. And I do have a flight to get immediately after this. I can't necessarily stay around and socialize and maybe answer all of your questions. If you have any others, I also have my email address here. Please feel free to reach out if you have any questions. Just scan the QR code and you'll have access to this whole presentation, my email address. I'd love to work with you and answer whatever questions I can. You'll see this QR code again in a moment. So if you don't get it just yet, I'll give you another moment. You'll have another chance. When I have people ask me, why did you become an ear doctor? Why is this so important? Why do you care? I think about some of my patients that, for example, my very first patient that I ever saw just broke down sobbing. They weren't able to understand their family, and because they couldn't hear, their quality of life was much worse. I've had patients tell me that they couldn't hear their family members' last words. I've had people talk about wanting to end their lives because their quality of life is so bad. When you can't hear, when you can't socialize with friends, when you can't understand your doctor's instructions for your life-saving medications, things get a lot tougher. It's important for you to think about hearing loss because hearing loss affects you. And I think that we have, you're going to get something in just a moment. I'll explain exactly what it is you're getting in the study in just a moment, but you'll be getting a pen. There's also a link with a couple QR codes and a cash gift. I'll tell you more about what that is in just a moment. Hearing loss, even if you don't personally have it, I guarantee it affects someone close to you. Hearing loss is very common around the world, with over 1.5 billion people having it. It's a bit less common among Westerners and in Western countries, but even among Western countries, it's still very common. And you can see that as we age, by about age 60, about 45% of people, getting close to half, have hearing problems. Even if you don't necessarily feel like you have hearing problems or don't have it diagnosed, I guarantee that your peers, your family, your friends, your loved ones, many of them do have hearing problems, and it is not a lot of fun. When we have hearing problems, it affects the things that make life worth living. One of the big things that hearing problems cause is dementia. Hearing loss, not being able to hear and communicate as well, is actually the biggest leading preventable cause of dementia. Preventable meaning that if we have hearing problems, it's really not good. But if we can appropriately treat those hearing problems, then the risk of dementia goes back to about the same level as people who don't have hearing problems. We'll talk more about treatment in just a bit. Hearing loss is hugely common and hugely impactful. It does things like make it difficult and exhausting and stressful due to events like this, to socialize with others. It can lead to isolation, brain atrophy, depression. It's certainly much harder to learn a new language like Thai when you have difficulty hearing it. I also mentioned healthcare providers. Many of the medications that we're on, many of the treatments that we do, like how to manage sleep apnea, for example, how to use our CPAP machines. When we have hearing problems and we can't communicate with our physicians and our other healthcare providers about how to manage those conditions, they can get worse. They can worsen our quality of life as well. For people who are still trying to work, people who are in school, people who are trying to raise their children, it can be very difficult. I've had many patients tell me that they just can't find or keep a job because they have difficulty communicating. They have difficulty talking to their boss, their customers, and many employers just don't want to bother with it. It's important for all of us to know about and care about hearing loss because it affects you, either directly or it affects the people you love. All that being said, I love the anatomy, the physiology of the ear. I used to lead dissections where we would go in and look at the tiny, intricate structures of the ear. I think that's so exciting. I won't bore you with too many of those details. I'll just briefly mention that your ear is actually much more complicated than you might even realize. The outside bit, the bit that we think of when we talk about the ear, is actually just one of the parts in your ear that sits deep in your skull. It's important to understand a little bit of this anatomy because when you have a hearing problem, sometimes it can be medically treated. Sometimes there's medication or surgery that can resolve your problems. Sometimes there's other problems that can't necessarily be medically treated or resolved. When we have a problem just in the outer part or kind of the middle part of the ear with the bones, the muscles, the eardrum, the cartilaginous bit that you see on the outside of our skull, those are more conductive problems. They just keep the sound from getting where it needs to be. Those are more easily fixed with medication, maybe surgery. If you have a hole in your eardrum, if your ear is blocked with earwax, easy fixes. Other problems deeper in the ear, like in a spiral, almost snail-looking shape you can see labeled as the inner ear, those problems are not treatable. There's no medication, there's no surgery that's going to fix it, and those are far and away the most common hearing problems we have. Age-related hearing loss, we call it presbycusis. It's one of those. It's what we call a sensory neural hearing loss. The cells that turn sound into some kind of electrical nervous signal our brain can understand, they break down due to age, noise we've been exposed to throughout our life, and in humans, there's no way to get those cells back. Once they die, they're gone, your hearing decreases, it doesn't get better. There are treatments, there are options to help resolve that and help manage it. Now let's take just a moment to talk about why do we get hearing problems in the first place? They get much more common as we age, partly because other conditions and diseases, from sleep apnea to autoimmune conditions, diabetes, high blood pressure, all of these conditions affect the inner ear, and they can cause that sensory neural hearing loss that isn't really resolvable, treatable, but not curable. The loud noises we're around in our life. Like, I work in Los Angeles, and many of my patients, they enjoy shooting guns. They go to, sports races. From sports boats, there's some, race car tracks in Los Angeles. Many people are around those intense noises. That damages your hearing too, even after just one exposure. Other things like some of the medications that we take for cancer, for serious infections. They can attack the infections and the cancer, but oftentimes they also damage our hearing. Some of the medications that you're on may even be worsening hearing loss or accelerating how quickly it happens. Other causes of hearing problems like head trauma after you've been in a car crash, sports where you hit your head, when you have infections directly in your ear, all of these things can damage your hearing. Sometimes temporarily, more often permanently. Hearing loss is a huge problem, and you might not even notice you have it, especially for age-related hearing loss that happens really slowly over years or decades. Oftentimes it happens so slowly we don't even notice the trouble we're having. Take a moment, think about some of these signs of hearing loss. Things like, do other people complain that you have the TV too loud? Do you notice that in social situations, in restaurants, meetings like this, when other people seem to understand and hear well, do you notice that you really struggle? Do you find that it's particularly tiring to be in those difficult listening situations, like after church, in echoey, loud places with background noise? Do you find that you're particularly tired because you have to spend so much energy trying to listen and understand? Those can all be signs of hearing problems. And as they get worse, these problems get worse, and for more severe hearing problems, you might not even be able to hear and communicate well, even in quiet places. So think, do you have difficulty communicating in background noise, in groups? That can be a sign of hearing problems. And as we know, about 45%, nearly half of people over age 60 have some hearing trouble. It's very common. It could be affecting you. It could be affecting your loved ones. Hearing loss is a huge challenge, but there are things that you can do. And, I am a doctor. I cannot give you personalized medical advice. We would have to sit down for about half an hour. We would have to talk about your unique situation and your needs. But some general advice is you really should see your physician and have an evaluation if you have things like pus or pain from your ears, if your hearing seems to come and go, if you have problems with dizziness or vertigo, which are also located in the inner ear, if you have problems in just one ear. All of these are signs of things that can be medically serious. If you have these signs, I would go to your physician. Some of these can be medically treated, some of them can't, but usually a hearing evaluation and a medical evaluation are a great first place to start. If you have concerns, if you're concerned about your loved ones, this is probably where I would start. When you're trying to start this process of getting evaluated for your hearing problems, you might find that you go for a medical evaluation. You see a physician, a primary care physician, an ENT, an otolaryngologist, some other type of physician. They would be evaluating for things like infection, head trauma, other things that can be more medically treated. The alternative would be something like a hearing evaluation. You would see someone like an audiologist, someone like me. I would play different sounds, high pitch to low pitch, loud sounds and quiet sounds, and make a graph of what sounds you're able to hear and what sounds you can't. That graph that we call an audiogram, that's the first step to really getting good treatment for a hearing problem. Really defining, do you have a problem? What pitches is it at? How severe is it? If you have concerns about your hearing, it's probably worth it to get both, a medical evaluation and a hearing evaluation. But we'll talk about it in a bit. It's actually really difficult to get a hearing evaluation here in Thailand. When we have hearing problems, especially things like noise-induced or age-related hearing problems, which are the most common, can't be cured. There's no medication that's going to fix it. If there were, it would be like the holy grail. It would be incredible for so many people, but that's just not something that we have access to. Hearing aids are what we usually think about for treatment of hearing problems. They make sounds louder at the pitches you need. They make it easier for you to hear and understand your family. They make it easier for you to hear alarms, car horns, and other safety signals in the environment. And there's many types of hearing aids. I've included a picture of just a couple. If you know people who have hearing aids, or if you use them, you might notice that the type that sits behind the ear with the little wire that goes in the ear, those are some of the most common. They're excellent, and they're almost always a good fit for most hearing problems. There are other styles, some especially are harder to notice, but hearing aids, they are usually the treatment that we go to. They're very complex, like little computers that do a lot of work. They have different features, they have different options, and if you're going to get hearing aids, if you feel like you have a hearing problem, then a prescription hearing aid is usually the best. It's when you go to an ear doctor, they test your hearing, they give you a hearing aid, and make sure it's putting out exactly the sound you need. But those prescription hearing aids are very difficult to get in Thailand. For Thai people, and especially for expats. There are problems with getting hearing aids in Thailand. Things like most hospitals not actually having staff to test hearing in the first place. Physicians to do a medical evaluation and check for medical problems are much more common. But we know that most hearing problems can't be treated medically. Most hearing problems, including age-related hearing loss, need a hearing evaluation and hearing aids to be properly treated and managed to reduce loneliness, to reduce risk of dementia. But it's really, really hard to find people who can do that in Thailand. There's only about 250 people in Thailand that do hearing evaluations. Only about one for every 300,000 people. For a health problem that has up to a 45% rate over age 60, this isn't nearly enough people just for the Thai population that has hearing problems, let alone expats. This doesn't even consider the problem of language barriers, lack of insurance, not being able to access these people who do these hearing evaluations and hearing aids. Even if you do work through the healthcare system and manage to get hearing aids in Thailand, they're not going to be as good as hearing aids you find elsewhere. Many of the hearing aid companies are based in the West, in Canada, Switzerland, elsewhere. They're very expensive because so much money goes into making sure that they work well, that they're durable. They do some background sound processing to help you hear as well as you can. All of those things make them very expensive. Often $4,000 to $8,000 US for a pair is pretty typical. Because, in many developing middle-income countries, including Thailand, there just isn't a big enough market for these companies that make high-end prescription hearing aids to want to enter the market. So we see that in Thailand, many of the hearing aids you get through, for example, the public healthcare system, they're not necessarily as high quality, and because of the cost, usually the public healthcare system only fits one. Usually you have a waiting period of over a year, and none of these things are ideal. If you have a hearing problem that increases your risk of dementia substantially, you want that treated as quickly as you can. And when we have hearing problems, usually they're in both ears. Things sound better, things are easier to understand when we have hearing aids in both ears. but that's not necessarily an option. There are some real challenges to getting prescription hearing aids here in Thailand, so I'm going to tell you there are other options. Ideally, you're going to get a hearing test. You're going to get a set of high-quality prescription hearing aids that are fit by a licensed healthcare professional to be as good as they can be for you. But if that's not necessarily realistic, there are other options, like over-the-counter or OTC hearing aids. You don't usually see them here in Thailand. You do see them in other countries. Like in the United States over the last few years, they've become much more common and they can be really helpful. They don't just turn sound up and make sound louder. The best ones, the self-fitting ones, they customize themselves to how you hear. They do a little mini hearing test, testing each of the pitches from low pitch, deep sounds, to higher pitch, like consonant sounds. And when they do that, they can provide the right level of sound for you. They're not necessarily meant for everyone, though. These kind of over-the-counter hearing aids are really only meant for more mild or more moderate hearing problems. If you have difficulty really understanding even in quiet places, for example, you might have a more severe hearing problem, and these over-the-counter options may not be a good option for you. If you are interested in hearing aids, you'll probably find these over-the-counter options are going to be the most accessible, cheaper, and easier to access for you. There are so many options you can find online. There are so many companies that make them. They're not all equal. Do be careful. If you choose to try to get over-the-counter hearing aids, then I have some suggestions. Just do be skeptical. Because hearing problems are so common, a lot of companies have gotten in with not great products that don't necessarily work very well, and they take advantage of consumers like us. There is a way that you can find high-quality hearing aids. There's the Food and Drug Administration, part of the United States government, has a really good database of high-quality, self-fitting hearing aids that you can buy over the counter, online, in some retail stores. So if you find that you're having hearing problems, and you find that going through that process to get a medical and a hearing evaluation isn't something that's a good fit for you, you might try looking to see if there's some options here. I've included a link, and I'll put up the QR code so you can download this presentation and access the link more easily in just a minute. You can use that little search tool that'll pop up and search terms QUH or QDD. Those are types of high-quality, self-fitting hearing aids. And you'll find that there are companies selling them based all around the world, from the US, Australia, China, elsewhere. There are high-quality options available to you, and you can find this. It's a useful repository of some that have passed through some government approval process that demonstrate that they are effective. You can find many options that aren't effective. Maybe there are some that are not on this list that are effective, but I can at least vouch for this particular database. You'll find it's probably going to be the easiest way for you to find reliable information about what hearing products are going to be best for you. All that being said, if you have any concerns, if you have especially problems that could be more medical in nature, like pain or hearing or ringing problems only in one ear, talk to your physician, talk to your doctor. That is the best place to start. Now, if you do have any questions that I'm not able to answer now or think of them later, you can just scan this QR code. It has this entire presentation. Yep, I see your hand, I'll get to you in just a moment. It has this presentation and all of my contact information. My contract with Chiang Mai University ends in just a few weeks, and I have another contract back in Los Angeles. Before I take your questions, there is one other thing that I would ask you to do. We've talked a lot about the challenges in getting hearing health care and in getting hearing aids here in Thailand. You'll notice that you were given a small gift, a pen with some QR codes and a cash gift inside. Chiang Mai University's Department of Community Medicine, California State University, and the University of California, Irvine, they all recognize that this is a huge problem that affects so many people and makes so many people's quality of life so much worse, that this is something really worth investing in. The QR codes you'll see are a survey. They link to a survey that I built, and you'll also see another unrelated survey for air quality. And these kind of surveys are how we understand the scope of the problem and how we can prove to people providing funding for the Chiang Mai University Department of Community Medicine and to the government to show that this is really a problem. I would very much appreciate if you would take a few minutes after our talk here, after you ask your questions, to fill out the survey as accurately and honestly as you can. The information from this is going to be used to help justify to the government, to Chiang Mai University Hospital, and to other sources to do research, to provide funding, to improve your access to hearing health care. So I won't require you to, but I would ask that you would fill out either the hearing survey or both surveys. That's the best way that we can help to improve this situation. I'm sure you have many questions. Maybe you're wondering, what if my spouse or someone I know has what sounds like hearing problems and they don't want to admit it? I would just recommend, maybe discuss with your spouse some of the things that you've noticed about their challenges hearing. Maybe try to reframe it away from a discussion of aging and more of a discussion of wellness. Many people don't like to talk about hearing aids or hearing loss because we associate it with aging and with getting older. It doesn't have to be that way. Many people in school, like some of my classmates, have hearing problems. It can affect anyone of any age, and what's really important is improving the life that you have now, with reducing dementia, making it easier to go out and interact with others. You can talk about, with your spouse, some of the positive things about hearing aids, like they help you understand your friends better. They help you get less tired after trying to listen and understand. They help you understand in restaurants and other really challenging situations. I saw a couple hands and a couple questions. Do you have a question here?
Yes, I enjoyed the presentation.
Thank you.
But I actually suffered a hearing loss back in 20. Sorry. And I had good treatment here in Chiang Mai. No problems. Hearing tests every time and quite sophisticated treatment. And I had good follow-up too. I think my last appointment was probably the beginning of 2022. And I was thinking I might go back and see the doctor I saw this year, just to reassure myself and have a hearing test.
Yeah, it can be good to have a test every year to every few years. And you can absolutely find high quality, excellent hearing health care here in Thailand. It can be a little bit more challenging, especially if you have a language barrier, but you certainly can. Absolutely.
It was very easy to find. I saw ENT registrar first, and he expected to see about 15.
The comment was it was easy to find and the ENT referred them to where they need to go. That's excellent. I'm so glad to hear that. Do we have any other questions that I can answer now? I see a question over here. Go ahead.
Hello, thank you very much for your presentation. I wonder, is the contact in Chiang Mai, is that available behind the QR code that you have there? You said you were here at a hearing aid center and so on. Was you come in connection with the university? Is that mentioned in your material?
I do mention some of the people in the Department of Community Medicine, and I include some of their names and the references that you'll find at the end of the presentation. I didn't specifically include their contact information, But if you'd like to be in contact, I'll definitely connect you to the people at the Department of Community Medicine that work a lot with expats and can answer your questions better than I can.
Thank you very much. I will contact you then by email, right?
Yeah, you can see my email here. Feel free to contact me. I'll connect you as best I can to the people who can help. Did I see another question over here?
Yes, mine was just regarding ear hygiene. Is there any recommendations that you have for one's cleaning their ears? I was once in China, saw ENT, and they actually seemed to use a vacuum to suck wax out. And it was pretty amazing. I never had seen so much wax come out of my ear before. I'm wondering, is that a practice we do in the West? I've never seen that. And if not, is there some other recommendation you have?
Yeah, that actually is a practice that we even do in my clinic back in the States. Oftentimes people have trouble hearing just because they have a lot of earwax. Usually our ears are pretty well self-cleaning and the earwax will automatically work its way out, fall out when we sleep, and you'll never notice a problem. If you do have a problem, especially in just one ear, then we can do things like reaching in with little tools or vacuuming out the earwax and get you hearing better. So that's why it's so important, if you do have hearing problems, go to a physician first, your primary care, an ENT, an otolaryngologist. It might be something simple. It might not be something serious at all. Most people don't have to worry about cleaning their ears and removing earwax because your ear does it by itself, but if you do have trouble, talk to your physician, talk to your ENT. They can help you understand what the best option for you would be. Did that answer your question?
Thank you.
I have perfect hearing, but I have tinnitus, and yeah, where does tinnitus come from, and what part of the ear does it affect, and is there any treatment?
That's a great question, thank you. Tinnitus or tinnitus are different sounds that we hear in our ears. It can be ringing, roaring, whooshing. Some people describe it like insects or the ocean. Usually it's caused by hearing problems. As our hearing starts to decrease or decreases just a bit, not enough to really have hearing problems, but when we're on the road to getting there, one of the first signs can be that tinnitus or tinnitus. When we have that ringing, it's because our brains are used to hearing a certain amount of sound. And then when we have hearing loss, and we get less sound than our brain knows we should, your brain tries to turn up the volume on what it is getting, but it accidentally makes tinnitus or tinnitus instead. So when we have that tinnitus or tinnitus, it's not typically a medical problem. It's not usually anything to worry about. It is usually a sign of hearing loss, which can be worse. But some of the things that you can do to help manage that are just avoiding quiet situations. That tinnitus tends to happen in quiet, when there isn't really a lot of sound. So for many of my patients that struggle with it, often when they're lying in bed trying to fall asleep, I'll just tell them things like, have a fan running, have some white noise in the background, maybe the TV on quiet. No sound that'll be distracting, but just a little bit of sound to help avoid quiet. That'll help that tinnitus get noticed less and potentially even go away. Did that answer your question?
It's there all the time.
Yeah, unfortunately, there's
Over the
no
top.
great cure for it other than when we use hearing aids and
Shiny
adding
deal.
more sound that our brain knows it needs, oftentimes it does go away. Did I see a question over here? Yes?
Yes. So, one of the jobs I had, I was the executive director of the American Tinnitus Association. I was executive director of the American Tinnitus Association. So I'm curious, but that was, I left that job in 2008, and I'm wondering if there have been any advancements in treatment since then that you would mention.
There are. The best treatment for tinnitus or tinnitus is just adding in the sound that your brain knows it used to get and knows it should be getting. So hearing aids are usually the best treatment, and there have been some great advances over the last few years. And special, hearing aids are like little computers, and they can generate special sounds customized to your tinnitus to help that tinnitus be less noticeable and potentially help it go away. That's not usually an option in over-the-counter hearing aids, but you'll find that most prescription hearing aids, they have special settings that your ear doctors can apply that many people find they're much more helpful than in years past. Did that answer your question?
Yeah, so the hearing aids were the most effective treatment then too, and the ones that you can, they set the specific frequencies, so they're the high-end aids.
That's exactly it. There's other treatments, other types of counseling. None are effective as just treating the root cause, which is usually hearing loss. Kim, did I see you have a question?
Yeah. Yes, I did, thank you. I'm wondering about the distinction between different types of hearing loss, because my wife has been diagnosed with Meniere's disease, with tinnitus, with sudden hearing loss, and there was something else. And these are 4 different diagnoses in the Boston area over 10 years. So is it legitimate of these different hearing specialists to focus on only one of those terms? Or are they all the same, or it just matters what the doctor likes to call it?
That's a great question. Meniere's is really tricky. That particular condition can look like a lot of different things, from balance problems, difficulty hearing that comes and goes, sudden hearing problems. Sometimes those can be affected by diet, sometimes not. Sometimes they're affected by other things like the medications we take. Meniere's is really tricky to pin down, which might be why your spouse noticed that there's been other labels that have been given for her condition over time. It's also possible, and I see many of my patients, they have several problems at once. I've had patients that have Meniere's, other inner ear problems, that also get sudden hearing loss, that also get tinnitus, and that have other additional problems too. Sometimes something like genetic susceptibility or a history of certain medications can cause Meniere's and other conditions to all be more likely. So I can't necessarily say without looking through her record specifically. It's entirely possible that she has one condition or that she has several conditions all working in tandem. The ear is so complicated and so intricate. I think it's so incredible how it all works. Did I see a question over here?
Yes, I don't know if this is a problem or not with me, but the last year or so I have become very, very sensitive to loud environments. In the 70s we used to have a saying that, if it's too loud, you're too old. Well, I noticed if I'm in any pretty much Thai venue, entertainment venue, including restaurants. I was at a burger joint the other night, and it was painful. Of course, it was hip hop, so. But is that an indication? I don't know if I'm overly sensitive to the loud sounds. That's what I'm saying. Is that an indication possibly of hearing loss?
Yeah, the medical term for that is recruitment. The same process that causes tinnitus. Your brain trying to turn up the volume on the signals it's getting makes loud sounds a lot louder seeming to you and uncomfortably loud. Even if other people don't necessarily struggle with it, because your brain, when you have hearing problems, tries to turn the volume up, we get this recruitment or this intense sensitivity to loud sounds that may not be loud enough to bother other people. That's a strong sign of sensory neural hearing loss. I can't diagnose you with that. I definitely can't say for sure that's what's going on. But when we have those hearing problems, we often see tinnitus and we see that recruitment. You're absolutely right.
I do have tinnitus.
They
As a
often
matter
go
of fact,
together.
right now.
We have I do have a flight to get. I'm sorry, I can't stay much longer. If we have maybe one more question I can take?
Yep.
Okay, this will have to be our last question and then we'll end.
Are you aware of anyone that has had any success in restoring hearing loss from NF2 patients?
That's neurofibromatosis type 2.
Yep.
There are. That particular condition, it causes tumors on the nerve that goes from your ear to your brain, and those tumors need removed. Doing so, you usually completely lose your hearing. There's a special device that isn't prescribed often, but for cases like this, we can use what's called an auditory brainstem implant. We put electrodes on your brain, and we connect it to a microphone you wear on your ear. The microphone sends those signals to the device inside and converts it to those signals into a form your brain can understand. And it's going to allow people with NF type 2 and other problems that mean that they don't have a hearing nerve, it can actually let them hear too. So there are absolutely options. We have to see an ENT to start that road to start to get some of those treatments. I think we are out of time. Thank you so much for your time.